Can we have the next speaker, Dr. Tisha Thomas?
A very good morning to all. So my study was on comparing retinal microvasculature in amblyopic and healthy fellow eyes of children using OCTA. So a brief introduction, we all know that amblyopia is a unilateral or bilateral reduction in best corrected visual acuity during the years of visual development secondary to abnormal visual stimulation. It's also defined based on visual acuity, that is 2 or more Snellen or logMAR lines difference between two eyes. And as per amblyopia treatment study, this is one of the most common cause of monocular vision loss in children. With the advent of OCTA, which is a non-invasive imaging modality, it permits visualization of microvasculature of retina throughout its depth. And it uses the variation in the OCT signals caused by moving particles such as RBCs as the contrast medium for imaging the blood flow, and the information generates the angiographic images within seconds. So aim of my study was to compare the OCTA findings of retinal microvasculature in anisometropic amblyopic eyes with healthy fellow eyes. Primary objective was to quantify the changes in vessel density in amblyopic eye and fellow eye, and secondary objective was to compare and find out the possible association between retinal microvasculature and amblyopia, and to correlate the severity and type of amblyopia with vessel density values. So I included children between 5 to 15 years, newly diagnosed cases of unilateral anisometropic amblyopia, and we excluded children less than 5 years and more than 15 years who are already on treatment, who have any other kind of amblyopia such as strabismus, deprivation amblyopia and nystagmus, history of any other previous ocular surgeries, any other ocular media opacities, other diseases of the visual pathway, glaucoma, neurological disease, and uncooperative patients were excluded from my study. So methodology, we included the study participants were children presenting to our OPD department of Shankara Eye Hospital, Coimbatore, and newly diagnosed cases with sample size of 40. And after taking parent informed consent form and child assent form, we did a refraction, uncorrected visual acuity and best corrected visual acuity was noted. Anterior segment and posterior segment examination was done to rule out any other pathologies, and patients coming under our inclusion criteria was taken up for OCT imaging for both eye using SWEPSOS OCT. So these were the angiography scan slabs. We took 3 × 3 and 6 × 6 mm slabs, and the interpretations were compared with the fellow eyes. We noted superficial capillary plexus density and deep capillary plexus density with the help of MATLAB software. And in superficial capillary plexus, we divided into fovea and parafoveal zone. Parafovea was again divided into superior, inferior, temporal and nasal. And in foveal avascular zone, so regarding foveal avascular zone, the parameters we included were area, perimeter, circularity and acircularity index. And macular cube of 512 × 256 scan was taken to know the central macular thickness. This was the statistical data analysis that we did. Coming to the results, so among all the variables, the logMAR best corrected visual acuity between the amblyopic group and fellow eye group was significant, whereas regarding the gender, we had an equal ratio of female and male children, and regarding the eye involvement also, we had a 1:1 ratio of right eye and left eye involvement. So the severity of amblyopia, we had more of moderate amblyopes, that is vision with 612, between 612 and 636, followed by mild and followed by severe. Regarding the type of refractive error, we had more of myopes followed by astigmatism and followed by hypermetropes. Now coming to the OCTA parameters which we studied. So first one was central macular thickness. We didn't have any significant change in the both eyes. And regarding the foveal avascular zone, that is area and perimeter, same, we didn't find any significant difference. Whereas in the acircularity index, we found that there is an increase in acircularity index in amblyopic eye group when compared to the fellow eye group. Coming to the density, mean vessel density of superficial plexus. So mainly in the parafoveal zone, we found that there is a decrease in vessel density in nasal and temporal quadrant of parafoveal zone in the amblyopic eye group. And similar picture was also seen in deep plexus density values also. So there was a decrease in vessel densities in amblyopic eye group when compared to the fellow eye group. And we found that there is a negative correlation between logMAR BCVA and superficial vessel density and deep vessel density. So my discussion will be the FAZ zone. Regarding the FAZ zone parameters, in our study we found that the acircularity index was increased, whereas there was no significant change in any of the parameters in a study done by Degussy. Whereas Tingerov et al. And Sobra et al. They found that there is an expansion in FAZ zone area and perimeter in cases of hypermetropic, ametropic amblyopia eyes. So this differences can be due to the different software that are adopted. So we used here SwepSource OCT, whereas in the other study they have used the C-Cyrus OCT. So that both the softwares are different. Coming to our central macular thickness, in our study we found that it was comparable in both the eyes, and the same picture was also seen in the study done by Tingerov et al. Whereas Nishikawa et al. And Lin Liu et al. In their study they found that the central macular thickness is increased in amblyopic eyes when compared to the normal eyes. So this difference can be due to the difference in age, sex and type of amblyopia. So I already mentioned our inclusion criteria was between 5 to 15, whereas these studies included little more elder children. Coming to the superficial and deep capillary plexus vessel density, we found there is a decrease. Similar picture was seen in Degussy et al. And Hamkro et al. Study, whereas in Sinar et al. They found there was no significant decrease. So again, this can be due to the difference in the OCTS softwares adopted. So I would like to conclude by saying that anisometropic amblyopic eye as compared to healthy fellow eye, we found that there is a decrease in superficial and deep vessel density values. So it indicates a possible association between retinal microcirculation and amblyopia. And quantitative analysis of retinal microcirculation in amblyopic eye using OCTA can be used as a reliable indicator of retinal circulation integrity. So these are my references. Thank you. Sorry, ma'am.
Was there any change in the OCTA with the improvement in the visual acuity?
Ma'am,
Or did patching made any difference?
actually,
Patching or
now
whatever
we are
mode?
doing a study on that, ma'am. So pre-treatment and post-treatment, is there any change? Is there any improvement in the retinal microcirculation? So that will be a long-term study that we are now coming up with that study, ma'am.
Who paid for the OCTA?
It was free, ma'am. It was like free of cost for the study.
No. Patient did not pay. That's.
Yeah.
I'm happy about patient did not pay.
No, it was
Because
for the study purpose, ma'am. So it was
done free of cost.
free.
Hospital paid.
Does it help the management of amblyopia by your study, and in any way is it going to help the patient?
Sir, this doesn't depend on the treatment as such, sir. This is just a finding. So the treatment part doesn't depend, because we need not do a OCTA for treating an amblyopia. So once amblyopia is found and detected, we can go ahead with the treatment part. So it's not a necessary investigation.
So what is the
So this is a finding, sir, and we want to know.
Help the patient or anyone?
No, so this is a findings, and we have found that because already there are other studies regarding LGB and choriocapillaries decrease in study. There are very few studies regarding the retinal circulation that I have done. So if there any contribution of retinal microcirculation to amblyopia, that's the study we have done, sir.
What is the theory behind that? What is the reason for this?
So there will be decrease in retinal circulation due to the decreased visual stimulation.
Or is it the other way around?
Yeah, it can be vice versa also.
Increase the retinal circulation.
Yes.
So that's the problem with doing OCTA.
Yes, sir.
So you don't know
Which is the first one?
you also don't have the normative data.
Yes, sir.
That too, for children, very little normative.
With data they have.
So you really can't make all those remarks, which is CMT increased and FSH
Yes.
increased and all.
Yes,
As
sir.
a fellow eye, as you are not
Comparing, yeah, yes, ma'am.